So say you're petting your dog and you notice a bump on the elbow that wasn't there before. And you're wondering, what is this thing and why is it here? Why does my dog have a bump on his elbow? Well, there's a lot of different reasons. One of the most common is a callus. A callus is an area of thickened, hardened skin that can form on the elbow if a dog is laying down on hard surfaces repeatedly. So it could be a callus. Could also be something called a hygroma, which forms when a dog lays down on hard surfaces repeatedly. And the trauma to the tissues on this bony prominence can cause fluid to build up under the skin. And so that bump could be something called a hygroma. It could also be due to joint diffusion from an inflammatory condition inside the joint, such as osteoarthritis. Osteoarthritis can actually make elbows swell up. Another cause for bumps on the elbows could be a tumor, could be cancer. Could be a tumor that's non-cancerous. There's lots of different tumors that are non-cancerous. Could be an insect bite or sting. Also could cause a bump on that elbow. Could also be a bony malformation. Maybe there's something weird with the elbow bone and you're feeling a bump there. Could also be that as well. Bottom line is, if you're noticing a bump on your dog's elbow, you need to take your dog in to see the veterinarian, and that veterinarian will help you actually determine what that bump is and what, if anything, you need to do about it. Can long-haired dogs get a hygroma? Of course they can. Any dog can get a hygroma, whether they have short hair, long hair, no hair, curly hair, straight hair. Any dog can get a hygroma. A hygroma forms under the skin in response to a large dog or an overweight dog that lays down or sleeps on a hard surface. And that repeated trauma of the tissue on the hard surface creates this pocket of fluid that forms. And so it's not the type of hair that puts a dog at risk. It's where they're laying, how often they're laying on the hard surfaces, and large breed and the overweight dogs are at much higher risk for developing a hygroma. If your dog has a callus and you've done some research on the internet, you may be wondering, is this callus going to turn into something like a hygroma, which is a fluid-filled pocket under the skin? The answer to the question, do calluses lead to hygromas, technically, is no, because they're two totally different things. A callus is on the surface of the skin, and it's usually thickened skin, it's hairless, sometimes it's discolored or it's gray, where a hygroma is under the skin and it's a fluid-filled pocket underneath the skin. You can actually squish them sometimes. Sometimes it can even look like a tennis ball is underneath the skin, a very soft one. Now, calluses cannot lead to hygromas. However, the same thing that caused the callus, which is a big dog or a heavy dog that is laying down repeatedly on hard surfaces, the same thing that caused the callus, which is those hard surfaces, can also cause a hygroma. So even though the callus does not lead to a hygroma, the condition that caused the callus can also cause a hygroma. So if you are noticing a callus on your dog's elbow, then you need to make sure that that dog is got cushioned areas that are soft and cushioned, and make it so that the dog can be up off hard surfaces when he or she is resting, or else you could get a hygroma. Hopefully that answers your question. What kind of dogs get hygromas most? Do crossbreeds get them more? Do purebreds get them more? Great question. And the short and sweet and easy answer to that is no. Crossbreeds do not get hygromas more than purebreds. What does get a hygroma more? Well, if your dog is a large breed, or your dog is overweight, or your dog lays down on hard surfaces, and especially if you've got all three of those together, then your dog is at increased risk for development of a hygroma. And you need to take some measures now to make sure that that dog does not develop a hygroma. So no. Hygromas form in all dogs that are large, overweight, and lay down on hard surfaces repeatedly. If your dog has a callus on an elbow, for example, you may be wondering how to take care of this to help it go away. Well, I have some tips for you. Number one, you want to make sure that this dog is not laying down on hard surfaces. A dog that continues to lay down on hard surfaces will continue to have trauma to that area of the skin, which caused the callus to form in the first place. So you want to make sure that this dog is not laying down on hard surfaces. One of the best ways to do this is to provide comfortable resting surfaces or areas for your dog to lie down that are cushioned. The dog needs to be up away from the hard surface. Big Barker beds, awesome for this because they cushion the dogs, they're about that thick. They cushion the dog up away from the hard surface, which allows the skin to start being able to go, oh, okay, I'm not squished on this hard surface, now I can start to heal. So number one, comfortable surfaces, provide multiple of them, and keep that dog up off hard surfaces. The second thing to do is if the callus is not infected, not red, not painful, not hot, not angry, it's just normal, hard, gray skin, is you're gonna wanna put lotion on that. Now before you do, you wanna make sure that that callus is nice and clean. So clean it with a gentle soap, nothing harsh, just something very gentle. And then you're gonna wanna apply lotion, you know, several times a day. Anything from, I mean, this is one place where you could use coconut oil, shea butter, bag balm, any of those super hydrating emollient lotions on that callus will give it some extra hydration and provide a space for that skin to start to heal. If the callus is infected or if it's really bad or hard or causing your dog's pain, then talk to your veterinarian about a steroid ointment. Sometimes low levels of steroid ointments or steroid plus antibiotic ointments can really help that skin to start to get out of the inflammatory phase and back into a healing phase. But again, if you're going to do steroid ointments, always do it under the supervision of your local veterinarian. The next thing you need to do is you need to make sure that that dog is at a healthy weight, because dogs that are overweight or obese are at higher risk of developing calluses. So how do you know? Well, talk to your veterinarian to see if your dog is at a healthy weight. You can also use what I call as the hand test. Feel your dog's ribs. They're right behind your dog's front legs. If they feel and look like the back of the hand, great, good weight. If they feel and look like the palm of the hand, too heavy. If they feel or look like knuckles, too thin. So make sure that that dog is at a healthy weight, less likely to form those calluses. So those are my easy tips to care for your dog's callus. Hopefully they were helpful to you. All right, so maybe you have a large breed dog and you've been doing some reading because you're that smart, savvy pet parent, and you have come across the term hygroma, and you read about the hygroma and you're like, oh my gosh, how do I prevent my dog from getting hygroma? So pretty simple, right? There's a couple of things that you can do. One, make sure that dog is not laying down on hard surfaces. Concrete, tile, wood floors, no. Not allowed. That dog needs to rest on carpet, and even more desirable, a orthopedic mattress, okay? Maybe a couple of orthopedic mattresses in strategic locations. The Big Barker beds are awesome for that because they are thick. The foam is awesome. It cushions the joints up away from the hard surface. And we all know that a hygroma forms in response to a bony prominence like this elbow right here, laying down and pushing on a hard surface all the time. So if you get that dog on a cushy surface, you're well on your way to preventing a hygroma. The next thing that you need to do is make sure that that dog is at a healthy weight, because overweight or obese animals obviously are at more risk for hygroma because that's more weight pushing down on those elbows and those hips, okay? So how do you know? Well, there's this simple thing called a hand test. I love it. I use it with all my clients. You feel your dog's ribs, and they are right, here's our ribs. A dog's ribs are located right behind its front legs, okay? So you just feel them with your fingers, like a washboard, okay? If it feels and looks like the back of your hand, you are good to go. That dog is at a healthy weight. If the ribs feel or look like your palm, too heavy, okay? Talk to your veterinarian about a weight loss program. If those ribs feel or look like the knuckles, too thin, need to get some weight on that dog, okay? So providing a cushy surface for that dog to rest upon, making sure your dog is at a healthy weight. Those are my 2 top tips to keep your dog from developing a hygroma. The treatment for hygroma is generally grouped into 2 big categories. Over here we have a non-surgical therapy, everything that is not surgery. Over here we have surgical therapy. And in this group, the dogs that have surgical care for their hygroma, they often get the medical therapy as well, okay? So if your dog's hygroma is very small or not bothering the dog very much, then you may be over here in the non-surgical therapy. So the best ways to treat a small hygroma is to get that elbow padded up with bandages and get that dog barred from laying down on hard surfaces. We all know at this point that hygromas form in response to repeated pressure trauma of a bony prominence on a hard surface, okay? So when a dog lays down on a hard surface repeatedly with its elbow or its hip, then it's more likely to develop a hygroma, which is a fluid-filled pocket under the skin. Feels very squishy and very round usually. So in order to get that dog to get better or heal from the hygroma, it cannot lay down on hard surfaces anymore. So you need to provide multiple comfortable resting spaces for that dog around your home that are not hard and keep the dog away from the hard surfaces. A orthopedic mattress such as the big Barker beds, which are like this thick, excellent option for these dogs because it cushions the joint away from hard surfaces. Okay? They also will teach you how to wrap this hygroma in padded, thick bandages because just keeping it padded, if it's not a big hygroma, the body can often heal itself, right? That's the best case scenario. If you are in that category, your veterinarian also may recommend to use some photobiomodulation. Very fancy word, means cold laser therapy, and that is non-invasive, not painful. Most dogs love it. It's where they take a cold laser and they laser in the area that is affected to reduce inflammation and speed healing. Another awesome therapy for hygromas. If your dog has a big hygroma or a hygroma that has broken open or a hygroma that is infected, then your dog may be in the surgical candidate. Again, you're gonna need to talk to your veterinarian and have them take a look at your dog to see what's the best case, what's the best treatment for that dog. But for the big hygromas, the painful hygromas, the infected hygromas, the open and weeping hygromas, those guys respond best to surgical therapy. So there you have it. Non-surgical, surgical therapy. Talk to your local vet to see what is right for your dog. So if your dog has had a hygroma surgery, then it is really important for you to follow all of your surgical recommendations from your veterinarian after surgery. In fact, the care you provide for your dog after hygroma surgery is as important to the success of that surgery as the surgery itself. So there's multiple things that are super important. First of all, when you do surgery on the skin of the elbow, there's just not a lot of skin there. And it's a high motion space, right? So this skin is moving and moving and moving, and it's really hard for that skin to heal. The sutures that they put in there are going to keep that skin together long enough for it to heal. But if the dog is active or allowed to lick or chew at that surgical site, then there is a high risk of failure of that surgery, which means that that surgery will just break right open and you'll be right back in the vet hospital paying for another surgery. So when your veterinarian says that you need to keep your dog quiet after surgery, then you need to do that. That means inside the house, in a kennel when you're not with him, outside on a leash only to urinate and defecate. We're not letting that dog off the leash and not letting that dog run around the yard at all. That is also making sure that that dog is not jumping, right? We don't want the dog running or jumping because that skin needs to heal, and it takes 10 to 14 days for that skin to heal. So another important thing is to make sure that that dog is not licking or chewing at that surgical site. Most likely you are sent home with a bandage over that. So you're going to make sure that that dog does not remove the bandage. whether if it's with a bite knot collar or an e-collar that you put on the dog, whether it's putting a stocking that the dog wears, a onesie that has a sleeve that goes all the way down, whether it is talking to your veterinarian about pain control, because the number one reason that dogs will lick or chew at a surgical site is because it hurts, and then later it itches because the skin is healing. So you need to talk to your veterinarian, make sure you have adequate pain control. If your dog is happy and bouncing off the walls and loves to be active and doesn't want to be cooped up, then you need to talk to your veterinarian about a sedative as well. Your veterinarian can prescribe something to you that will keep that dog quiet. And you want to make sure until those sutures come out and you see that that skin is healed up, that that dog does not have access to that surgical site at all, or you're going to be right back in with another surgery. And I can tell you the second surgery is going to be even more difficult to heal. So you want to do everything right from the first get-go. The second thing is there's going to be a bandage. So you want to make sure that that bandage stays in place, that that bandage does not get wet, that there's no odor coming from that bandage, because an odor is indicative of an infection. You want to make sure that the leg below the bandage and the toes look normal. So they're going to have you checking the toes for any kind of swelling, because that's signs that the bandage is slipping or it's too tight, right? So you're going to have bandage care. And that bandage is going to be really padded, because we want, when that dog lays down, for it to lay down on padding. So you may be asked to do some bandage care at home as well. If you don't understand what your veterinary care team is telling you, make sure to ask questions. Don't be ashamed to ask questions. Make sure you understand what you're getting into, because this is your investment in your dog's health, right? So ask questions, and if you don't understand, don't hesitate to ask more questions. And if you're not comfortable with what things look like, send in a picture. Take a picture of what it looks like, send it to your vet, or take your dog back to the vet. Or if you're not comfortable with the bandage care, take it in and have them do the bandage care for you. They would love to do the bandage care for you. The last thing is you're going to want to make sure that you finish all medications as prescribed, including antibiotics and pain meds, because the signs of pain in dogs are very subtle, and you might be thinking, my dog's doing fine, doesn't need any more pain meds. Well, probably still needs the pain meds, because you stop the pain meds, then the dog's like, well, what is this thing? And then it starts chewing, right? So finish all the pain meds, finish all the antibiotics. Very, very important if they're prescribed. Lastly, if your veterinarian recommends any kind of adjunct therapy, such as photobiomodulation, right? That's just a fancy word for cold laser therapy. It's an awesome therapy that speeds healing, not very expensive, not invasive, feels very good to your dog. Then do it, because this is an investment. This is you making sure that your dog is going to heal the best possible after hygroma surgery. And then lastly, you're going to want to make sure to get back in for all of your post-op rechecks. Most likely, they'll have you back in for a suture removal and then a checkup after that. So those are my best tips for how to help your dog recover the best from a hygroma surgery. So do you have a callus on your dog's elbow, or is it a hygroma? And how do you tell the difference? Well, knowing the difference between these two is important, because they require different types of treatment. So how do you know the difference? Well, a callus is simply an area of thickened skin that is usually hairless, and sometimes it is discolored, it's gray, but there is nothing underneath that. It's just some thick skin, very rough. A hygroma, on the other hand, is something totally different. A hygroma is on the same place that you'll find a callus, which is usually on someplace like the tip of the elbow, but a hygroma is a fluid-filled pocket that is under the skin, so it'll feel like fluid, like you can squish it. It usually still has hair on it, unless there is a callus on top of it, but a hygroma is something that is under the skin, where a callus is on top of the skin. A hygroma may have hair on it. A callus usually does not. Hopefully that clears it up for you. If your dog has been diagnosed with a hygroma, you may be wondering what are the signs that this hygroma is infected, because an infected hygroma is not a happy hygroma and usually needs surgery to have it corrected. So how do you know if this hygroma is infected? Well, the cardinal signs of inflammation are the same in any mammal. If the hygroma is hot to the touch or warm to the touch compared to the rest of the body, if it is red, if it is painful when it's touched, if it is open and weeping, any type of colored or white fluid, if it continually opens up, then those are all, and your dog is looking at it, then those are all signs that that hygroma is infected and needs the attention of your local veterinarian. So you're looking at your dog, maybe at the elbow or the point of the hip, and you're seeing something on the skin that is not quite right. And you're like, what is this thing? Is it maybe something called a hygroma? Maybe you've Googled hygroma and you're wondering if that's what this thing is, or is it something called a pressure sore? And how do you tell the difference between the two? Super simple, okay? So hygromas form under the skin. Easy, right? It's a fluid-filled pocket, it's under the skin, and it's usually covered with hair. Now, if a hygroma is very, very big or broken open, it can get a little confusing, and you may need to talk to your veterinarian. But if it's just a normal small hygroma, it'll feel like a squishy, fluidy bump that is underneath the skin. Could be, you know, as big as a golf ball. I've seen them big as tennis balls, but oftentimes they still have hair on them and they feel like a fluid-filled pocket underneath the skin. A pressure sore, on the other hand, is an ulceration in the surface of the skin. These pressure sores are always open, they're always red, they're usually weeping, they often have crusts around the edges of them, they're pretty gross, they're angry, they're weepy. The confusing thing is they form in the same place as a hygroma, on the point of the elbow, on the point of the hip. But those things are always open and weeping. Bottom line is, if you have any kind of open or weeping sore on any bony prominence of your dog, then you need to see your local veterinarian for some help. But hopefully those tips are helpful to help you determine whether you're dealing with a hygroma or if you're dealing with a pressure sore. So you're watching this video because you've come across the term ischial hygroma, or your veterinarian has said your dog has an ischial hygroma, and you're like, what the heck is this thing? So a hygroma is a condition that occurs in response to tissue, skin tissue, being repeatedly traumatized by laying down on a hard surface. And it usually occurs over a bony prominence, like my elbow right here, right? So if I lay down with my elbow all the time on a hard surface, concrete or whatever, that squishes the tissues, makes the tissues angry, boom, hygromas form. Hygromas are fluid-filled pockets underneath the skin, and they form on your elbow, as we've already talked about, but they can also form on the point of the hip. So if you feel your dog's hips back by his tail, you'll feel, you know, a couple little points sticking out there, depending on how heavy your dog is. Thinner dogs, it's easier to feel. Those points are the wings of the hip, or the ischium. And now you know what an ischial hygroma is. If your dog has a hygroma, how do you know if your dog needs surgery? Well, your best bet is to have a veterinarian look at your dog's hygroma and give you their opinion. In general, here are the guidelines. If the hygroma is very small and you can take measures now to treat that hygroma, you can treat small hygromas that are not infected medically. That means not without surgery. So without surgery, you can treat small hygromas. If you're going to treat a hygroma without surgery, you're going to need to make sure that dog has multiple comfortable places to lay down, that that dog is not laying down on hard surfaces, that that dog is at a healthy weight, and that that hygroma is not infected. Now, hygromas that are very large, hygromas that are open and weeping, so they're weeping fluid out of them, hygromas that are infected, and an infected hygroma is red, it's angry, it's pussy, it's hot to the touch, it's painful, or if you have a hygroma that you're trying to treat medically but it just won't go away no matter what you do, that may be a candidate for surgical therapy. But again, you need to talk to your local veterinarian and get their opinion, because they're the ones putting their eyes on that dog to let you know the best course of action to treat that hygroma and get your dog back to normal life. Why do dogs choose to lay down on hard surfaces? I mean, it's not very comfortable, right? But there they are. They're just out there laying down on the concrete or the tile or whatever. Why are they doing this? Well, just like humans, dogs get hot. And overweight dogs get even hotter because they're insulated by all that fat. And so what does a hot dog do? Well, a hot dog is gonna try and cool him or herself down by seeking out a cool surface. And if you've ever laid down on a nice cool tile or concrete on a summer day, man, that feels good, right? Your dog thinks the same thing. So if your dog is hot, it's gonna go lay down on a hard surface. That's usually the only reason why they'll choose those hard surfaces. So if you got a big dog and your dog is hot and it's summer and you don't want them to get any kind of calluses or hygromas or pressure point sores or anything on their skin or their elbow, well, what do? Well, one great tip is to provide a kiddie pool for that dog to lay down in. Just go down to Walmart or whatever and get a little kiddie pool, fill it up with, maybe 3-4 inches of water, and let that dog go to town. He's gonna really love that way. The other thing is to just keep your dog inside an air-conditioned house or home or apartment, and make sure that that dog does not have access to hard areas, maybe barring access to kitchens or bathrooms with a baby gate, and then provide a cushioned surface. Big Barker beds are excellent resting space because they have thick cushioning that keep those dogs' joints up off the floor. So yeah, keep that dog cool, less likely to go seek out a hard surface to lay on.